Okay, so thank you very much for the introduction. I'm just going to say a few words about each of us as presenters before actually starting the presentation. And thank you to those of you who are attending this webinar. So first of all, so for myself, I'm the one on the left. So my background is in psychology and psychotherapy. I did my PhD at Bradford University in England, specialising in dementia and stigma. I'm the director for projects at Alzheimer Europe, where I've been working since 1996. And I'm involved in different European projects, mainly working on ethics and supporting the European Working Group of People with Dementia. So I'm actually involved in the ethics work package of EPAD. In the middle, we have Anna Diaz, my colleague. Anna's background is in sociology and social work. She did her PhD at Trinity College in Dublin, specialising in dementia and quality of life. She's been project officer at Alzheimer Europe since 2014 and has been involved in different European projects. And this includes being responsible for Alzheimer Europe's involvement in the Paradigm project on patient engagement in the development of medicines. Anna also supports the European Working Group of People with Dementia. And then on the right, we have Helen Rochford-Brenan. Helen is the current chairperson of the European Working Group of People with Dementia, and as such, she's also a member of the board of Alzheimer Europe. She's former chair of the Irish Dementia Working Group, and is on the monitoring committee of Ireland's first national dementia strategy and is a global dementia ambassador. Helen campaigns to raise awareness of dementia through a rights-based approach. She speaks at international conferences, engages with pharma, scientists, clinicians, educators and students, and is involved in many research projects. Throughout Helen's life, she's been a rights and social justice campaigner, and today advocates for the rights of people with dementia, in particular Alzheimer's disease. So in this webinar, we're going to discuss PPI in general, then focus on PPI more specifically in relation to dementia. We'll then give you some examples of PPI work with the European Working Group of People with Dementia, and we'll end with some conclusions and recommendations. And Anna and I will present the more factual aspects of this webinar, and Helen will give her perspective as a person with dementia and share her personal experience of PPI in the context of dementia research. So first of all, the terminology. I'd like to clarify the terms we're using. At Alzheimer Europe, we adopt the same terminology as that used by the Involve project, which was funded by the National Health Service in the UK to explore public involvement in NHS, public health and social care research. And by public, they included patients, potential patients, carers, service users and representatives of those users. So as you'll see on this slide, involvement is about research being carried out with or by patients and the public, and not to, about or for them. It's about people with dementia being actively involved in research projects. Engagement is about raising awareness and sharing knowledge about research. The key word here is telling. So it's about providing and disseminating information and knowledge about research. It might, for example, involve science festivals open to the public, open days at research centres, media events, or disseminating research findings to research participants. And then participation is about taking part in a research study, literally as a participant. It involves being recruited, giving informed consent, and taking part in a study or trial. And the key words here are providing data. But you'll sometimes find the term patient engagement being used for PPI and vice versa, or both being used together. So there's no actual consensus on the terminology at the moment. PPI involves a range of activities. On this slide, you can see some of the areas where PPI takes place in the context of research. So for example, it could be at the very early stage of a project, contributing towards the identification of ideas for research. It could be with regard to the prioritization of studies, contributing to discussions about which project applications should receive funding. And it could also involve providing assistance defining the topic and the research question. People can play an important role in contributing towards discussions about ethical issues and exploring the ethical and social implications of the research. They can contribute towards the design of studies by providing input and feedback on the development of participant information sheets, informed consent forms, and in decisions about the number and duration of visits for participants in clinical trials, for example. With regard to the management of studies, people can contribute to projects by being members of project advisory committees or steering groups. Another area of involvement is in data collection, conducting interviews with research participants or in collaboration with the researchers, and being involved in the interpretation of the findings. And finally, people can contribute towards the dissemination of findings, for example, determining the content and scope of the dissemination materials and helping ensure that findings are communicated in an accessible format. And they can also contribute towards the development of research-related policy. It's hopefully clear from this description of ways of involving people in research through PPI that there are numerous possibilities which differ with regard to the extent of involvement. And this slide depicts the different possible levels of involvement along a continuum, ranging from involvement in a particular task to involvement at several or every stage of the research process, through to involvement as a member of the research team, which is quite unusual but not unknown. You might have heard about Einstein's ladder of citizen engagement from 1969. Einstein initially set out to distinguish different levels of citizen participation in policy discourse in relation to levels of or access to power. And it's frequently used as a metaphor for describing and attributing value to different levels of involvement. Although it's often used, in our opinion, PPI should be organised, PPI should be organised according to the requirements of the study, taking into account people's skills, experience and knowledge, as well as their availability and the funds available. Any involvement must be meaningful and respect the well-being of the people involved, and it should be a mutual exchange, a kind of win-win situation, with people involved and researchers both gaining something from the exchange. So we don't consider some forms and levels of involvement as being superior to others, or consider that PPI is about power. We see PPI as occurring along a continuum rather than as a hierarchy like a ladder, which we find unhelpful. Continuing with the topic of the level and type of involvement, patients and the public may be asked to contribute towards PPI in research using a wide variety of methods. So this might be interviews, focus groups, surveys, questionnaires, Delphi rounds, user-led forums, email and Skype consultations. But in most cases, qualitative methods are used. PPI is therefore an overarching term, which makes it a little bit difficult to compare its impact in different studies. Nevertheless, it represents a step towards recognition that people have a right to voice, with suppression or denial of that voice being considered a form of abuse. Turning now to why PPI is important, it's a core democratic principle that people who are affected by research have a right to have a say in what and how publicly funded research is undertaken. The inclusion of their voice in the research team provides a unique perspective from the inside, the lived experience, and it can promote the transparency, validity and legitimacy of research projects. Knowing that patients and the public have been involved in a particular study may also increase trust and confidence of end users in the reported findings. It's therefore important to ensure that such involvement truly adds to the value of the research and it's not just a matter of ticking the box. And now hand you over to Anna for these slides.
Dianne has referred now to PPI, to public and patient involvement in general. I would like now to more specifically to PPI in the context of dementia. Traditionally, for many years, and still in many countries, people with dementia have not been included in research or in public and patient involvement activities. And there have been many different barriers to that. Often the reliability of the views and opinions of people with dementia were questions and the validity put in question mark, but also other issues such as, for example, consent and capacity were perceived as barriers for their participation. So often what has been done is that the carer's perspective had been sought instead of the views of people with dementia themselves. Whether that looked like a good solution, evidence research has shown that also this is not so as straightforward as it looks like, because often the priorities, preferences, and the perspective of people with dementia and those of the carers might not be exactly the same. Over the last decade, we have seen a change in in that perspective, and due to many different reasons, the relevance of involving people with dementia themselves, both as research participants, but also as taking part in patient and public involvement activities, has been recognized. And there might be many different reasons for that. In the slide, you can see a few reasons we are thinking, perhaps because diagnosis is happening now in many countries in a more timely fashion, perhaps because there's less stigma in some countries, and also because we are seeing now more and more people with dementia speaking up in different conferences, in different audiences. So all of that might have contributed to that kind of recognition. And we have now many examples of PPI, of patient and public involvement, in the context of psychosocial research, and also in many different European projects. We'll be presenting later on some of these examples. However, we want also to raise the point that this is not happening all across Europe. There's many European countries where still this is not happening, and also that this is not as frequent in biomedical research. After this short presentation about public and patient involvement and dementia, we would like now to hand over to Helen so she can tell you about her personal experience and why this is important to her. Over to you, Helen.
Thank you. Thank you for allowing me to participate this afternoon, and why my voice matters. As we are coming to the end of Alzheimer's month, I would just like to quote Terry Pratchett: "So much universe, so little time. I am not sure how much time I have, or how much capacity I will have, but I have hope, and that hope keeps me involved in PPI research. I was diagnosed in 2012 after 5 years of wondering what was wrong with me. I couldn't understand why I couldn't remember things. I couldn't remember words. I couldn't remember names. I couldn't remember how to do ordinary household chores. I went to meetings and I couldn't remember. As I chaired a meeting, the word wouldn't come, and I can still feel that burning silence. Names every day became a major chore, and I went to work and my in tray never seemed to move. I was a busy woman. I was a mother, a wife. I was extremely busy in my community and in my country. So all of this was a difficult time for me. And I suppose at home, when my husband would tell me something, or my son would call me and tell me something, and then I could not remember it. They could see the decline. And finally, I ended up getting a diagnosis of early onset Alzheimer's. And I remember driving home alone, about 60-something odd miles. And I was thinking to myself, how do you tell your loved one in an undisclosed amount of time you may not recognize them or remember all those memories you have banked along the way? All the retirement plans, all of the things you were going to do in one small moment were wiped away. So there was no support for me here in Ireland because I was under 65. But all I had was Dr. Google, and may I tell you, I don't recommend it. So there was 10 months of grieving for a life I would never have, and all the plans that were gone. And I couldn't tell anybody because of the stigma around it. The doctor referred me to the Alzheimer Society, and I was a bit apprehensive about going because I knew that it was for much older people than me. But the nurse told me that I should get involved in research. And this was the day that my journey into life began, because I contacted Trinity College, Dublin, who had been involved with cognitive rehabilitative therapy research with the Alzheimer Society of Ireland. And so I joined that group of researchers, and I began to really get some strategies for my life and understand that by participating in research, that I could really do something useful again. I could see suddenly that it was going to be meaningful. I joined the Irish Dementia Working Group, which were being newly formed, and I became chair of it. And I met people that had the same illness as me. And we all realized one thing, that we had to tackle stigma. And for me, I also realized that my rights were being violated. And having as Dianne told you earlier, spent my life as a social justice campaigner and as a rights campaigner, I found that violation of my rights was all too much. So what better way to tackle it than through research? So we began together, myself and my colleagues in the Irish Dementia Working Group. First, I got very involved with my colleagues in the Alzheimer Society of Ireland in drafting a Charter of Rights. And then I became involved with research around the National Dementia Strategy. And I think that then I found a way to universities right across the country in taking part in research with them. And I think that was really a great moment for me. But it wasn't just a great moment for me, to be honest with you. It was a far greater moment for the researchers, because up until then, they hadn't realized that we were able to speak for ourselves. So I realized I was helping others. And also the important thing for me was that to talk about being diagnosed. And I began to talk about that. I was the first Irish person to go on television and to say, I have the illness. Again, that called for more research, more work. In my community, it's important that they know that I need social support. So I want to feel fully integrated into my community. I don't want to feel different. I feel that I'm still the same person and I can still make a great contribution. I'm more than an illness. I can still contribute to research. And it daily reminds me how useful it is. And with all of the work we've been doing with Alzheimer Europe, through the European Working Group, this has even brought it more home to me, the importance of research. And all of the researchers I've met along the way, I have to say, some of them have been dumbfounded that we can participate as well as we can. So there are many different ways that we can help. And I do it because I think that researchers must understand that we can make a contribution, and it's so important we all work together. There's so many times, as I said, I see researchers speechless because of my contribution. And another thing I realized was, which I helped change, was I was doing some work with the International Consortium of Health Outcome Measures, and I realized that my quality of life seemed to be missing. And I made that contribution. I made that I suppose I appeal to them to look at me more than just health outcomes. It has to be about my quality of life, and has to be about the quality of life of all of us dementia. And I was able to change that. And I think that's where research happens, to be good when we communicate with each other, because we look at different ways that we can see things. I've worked on many different pieces of research, and always comes back to the same thing, that our contribution really matters to the researcher. I've recently been involved in looking at non-pharmacological interventions and the abuse of antipsychotics medicines. And those, by hearing the voice of the person, is really helping the researcher to make the decisions. Maybe, maybe we don't need medicines. Maybe we, at the early stages in particular, maybe we need help with climbing a mountain or going to the opera or the theatre, or just to share our lived experience with the researcher. It really helps, and it helps with the work. So I think for me, we must continue our work in research, because that is where it is going to happen for the future. And personally, I think that any research that is funded, the person with the illness should participate in the research, because at the end of the day, we have the illness, we have the experiential knowledge, and we can help. And I think it's an important message also that we give out to our young researchers. And we know how difficult it is for research across the world. And I certainly have experienced the high turnover of researchers because the money isn't there. But I think if we keep speaking out as people with dementia about the lack of funding for researchers, then I think we will all bring a better world to a better place in the world of research. And I think it's also a powerful message that we are given to the newly diagnosed, because they're beginning on their journey of what it's like and thinking that, their life is over. We want them to know that we can be active citizens and fully participate in society to the best we can. Thank you.
Thank you very much, Helen. I'm just going to very briefly now talk about the European Working Group of People with Dementia, of which Helen is the chair, just so you have a bit of background information about it, because these are the people, along with Helen, who are involved in the different PPI work. So Alzheimer Europe set up the European Working Group of People with Dementia in 2012 on the occasion of the annual conference in Vienna. It's comprised entirely of people with different forms of dementia who are nominated by the national Alzheimer associations for terms of 2 years. The group meets 3 to 4 times a year, and in 2018 it had 11 members. The members of the group have mild to moderate dementia, and every member has the right to be accompanied to the meeting by a person of his or her choice. And the European Working Group works to ensure that the activities, projects and meetings of Alzheimer Europe duly reflect the priorities and views of people with dementia.
The Nexus Lights, we are going to provide some more concrete examples of the work that the European Working Group People with Dementia has been involved in the context of PPI. And in particular, we want to bring to your attention 4 of the projects where they have been involved, and also 2 peer-reviewed articles to which the group has contributed to. The first project we wanted to share with you is Roadmap. This is an IMI project, and the project is running from 2016 to 2018. Within Roadmap, you can see there the full title of Roadmap. Within the project, there was a particular interest in one of the work packages to actually understand better what are the outcomes which are of interest to people with dementia and to carers, as well as to other stakeholders, and also trying to understand better what disease progression means to people with dementia, and in particular what a meaningful delay might mean to them. So in that context, we organized a consultation with the European Working Group of People with Dementia over 2 days in Brussels. We have all the members of the group and also their supporters participating in this consultation. This was co-facilitated by Alzheimer Europe staff, but also with the contribution from researchers from Edinburgh, who are the ones leading this work package in particular. We developed a facilitator guide where we have the different topics that we wanted to address with them and the different questions and prompts to be used during the consultation to help them into addressing the topics. And we had 3 key issues that we discussed with them. The first one was one online survey. What Package 2 was working on a survey for the different stakeholders about outcomes and the relevance of different outcomes. So one of the people who were supposed to be responding to this survey were people with dementia and carers, and in that context the people with dementia and the carers from the group were providing feedback about the different questions and the presentation and different aspects of the survey. And then also then the topics I was mentioned earlier before that were of interest to the project, we were discussing with them, for instance, what the understanding of disease progression and how in the literature disease progression is often presented, and how sometimes professionals talk about disease progression and meaningful delay, and how that's important for people with dementia and their own understandings, and lately about what the outcomes, which outcomes in particular those who are typically used might be more relevant, and whether there's any gaps or anything that might not be addressed. And here you can see a few of the photos of the day. So you can see we use different activities and different techniques throughout the 2 days to help people to express their views. So you can see in the first picture there, we had the group split in smaller groups to help people to convey their opinions, to have more possibilities for people to speak. And we also use sometimes I want to speak cards and helping people to facilitating them to talk. Then we also use other strategies. You can see in another picture there, we also use green and red dot stickers to help them in the prioritization of outcomes, to mark the relevance of different outcomes. We also sometimes support them with, like for instance, the use of flip charts to to keep track of the conversations, to make summaries of what we discussed, and very often they themselves, when we have work in small groups, they present themselves the summaries of what the group had discussed and try to see difference among different views within the group. And why is roadmap important? It's also important because it was not just a one-off. It was not just people from Edinburgh coming to the group one time and talking to the people with dementia. It was an ongoing, it has been a very much an ongoing collaboration. And for example, as I was mentioning, we were addressing and discussing with the group about the survey that roadmap was developing for people with dementia, and several of the aspects I was discussing in the group were then implemented in the survey, and several of the questions were unchanged. Some of the formatting was changed, but also sometimes was key aspects, like for example, they had a differentiation in the survey about Alzheimer's disease and dementia, and that was something considered to be quite difficult for people with dementia. So they agreed on throughout the survey to change that and to use in a consistent way all along the word dementia. And that was quite an important change in the way the survey had been conceived. Also, in regards to the other conversations, the researchers, we recorded all the conversations and that were transcribed. And then the researchers worked to identify the main themes and concerns that were discussed within the group. And they drafted a report, and this report was shared with Alzheimer Europe, but also with the members of the European Working Group. So all the members received the report, what the researchers felt was more important, and they had the opportunity to provide feedback in writing about whether there was any gap, was anything that was different from what they wanted to say, there was anything that they wanted to add. And also we had then later on the year, the main researcher from Edinburgh coming back to the group again and having again another opportunity to talk with the group about the final report and how the deliverable for the project would look like and how their contribution would be used within the project. So that was a quite kind of a relationship between the researchers and the working group for a long period of time, with several opportunities to contribute and to have feedback and to have this kind of relationship between the different parts. And also in the long term, the European Working Group and the CARES contribution would be acknowledged in any publication about this work that they had been involved in. So this is a second example. It's another project. This is Induct. Induct is a Marie Curie action, and it's from 2016 until 2020. This is about PhD students working on the area of technology in dementia. And I think from the very beginning, at the core of the project was to actually have the voice of people with dementia in the work of these PhD students. And the idea was to have people with dementia really helping them, helping them throughout their research project. So mentoring and supporting the students. So they have different meetings with members of the group and the students where they could talk about things of interest to the students, for example, about the topic they have decided for their PhD research, but also about, for instance, how to involve people with dementia in the research, what to consider when interacting with people with dementia, ethical issues they might have in mind. So they had the opportunity to discuss with people with dementia themselves about these different about their work and the relevance of their work for people with dementia. So this was a quite novel thing for us from Alzheimer Europe and also for the group. And I think it's been something of a very interesting relationship and something that's been very important for the members of the group to be able to help all these researchers, all these people who are starting to do this research and help them into be more aware of the lived experience of dementia. And you can see here a few photographs, again, in this case from Induct. You have one of the members of the group, Helga, presenting in one of the meetings of Induct. You have there also 3 members of the group, Idalina, Nina, and Chris, when they were visiting the Induct students in Salamanca in Spain. And also, as you can see in the other 2 photos. There was also opportunities not just to discuss with the students, but also to sit with the people who are actually coordinating the work of Induct, the people who are actually supervising the PhD work, and also influencing the research, the project from that point of view. So it's also a very rich, interesting, and novel way of involving people with dementia in that case, in helping out and mentoring PhD students in developing the research. Another of the projects I wanted to present today is Paradigm. This is again an IMI project. This is started this year in 2018 and, and will be running until 2020. Paradigm is about involving patients in the development of medicines. Paradigm is not just about dementia, it's about how to involve many other patient groups in developing medicines. In that case, they have an interest also in understanding how to make that involvement possible for many different groups. And in particular, they wanted to understand better how some groups, like people with dementia, could actually be involved in developing medicines. In that case, we organized also a consultation in Brussels. That time was a one day. And with them and with the help of people from the consortium, we had some discussions about the views on patient involvement in the case of dementia, who should be invited to take part in patient involvement, what should be considered to enable people with dementia to be involved in that way. What's in it for people with dementia? Is that something of interest for people with dementia? And what should be the outcomes for people with dementia involved in that way? And finally, also, the project wants to make patient involvement sustainable and also to develop from an ethical point of view. So we also wanted to contribute to that from the perspective of something with dementia. Is anything that the consortium needs to consider regarding the sustainability and the ethical issues if people with dementia are involved. So how the view should be incorporated. And all that work, we are currently working on this feedback. This consultation happened just before the summer, so we are still working on this feedback. But this is going to be incorporated along the views of the patients in the development of a Delphi process to prioritize which are the more important aspects for patient engagement. And the group will be also heavily involved in this process and the Delphi and this process as experts. This is again some of the photos from the day in Brussels. And you can see in the first picture, this is the whole working group with the supporters, Dianne and myself, and then the other 3 people who came from the Paradigm project. And again, here we use different techniques, different approaches to help people address. We have, in some cases, we split the group into smaller groups. We also use vignettes to help them think in a more specific way about some of the issues that we wanted to address. We also have there some of the people, Helen and Helga, providing summaries of what was discussed in the smaller groups and trying to see the difference between the different the opinions that we're addressing each of the different groups.
Okay, so then this is the last project that we're going to talk about briefly now, and that's the PredictND project. The PPI activities related to this project were in relation to a specific part of it, which was to develop a low-cost battery of tests for early detection of cognitive deterioration, presented in the form of an ICT ecosystem, a kind of website. As you can see from this slide, the involvement consisted of hands-on work in small groups to test and provide feedback on the computer portal, discussion in a large group about the experience in the small groups, and then to facilitate the discussion, we projected the portal onto a large screen, and then we wrote up the feedback from the discussion, which was quite lively, and this was approved by the European Working Group of People with Dementia and then relayed back to the IT designers. And so why was this important? Well, the involvement of the European Working Group in the design of the ICT ecosystem led to significant improvements and adaptations to the portal. It also resulted in the researchers revising their plan of how the portal could be further developed for use in the real world, so to say, after the end of the project. It became clear that some issues might need to be addressed to ensure the continued use of the portal over a sufficiently lengthy period of time, and to motivate people to use the system on their own and not just in the clinical context and limited time frame of the study. So this was very valuable feedback for the researchers, clinicians and IT designers.
So we have presented the work we have done in 4 research projects, but PPI is not just about research projects. It can be much broader, and it can be brought in many different contexts. And this is why we wanted to also present another kind of different type of work that the working group has been involved in. And this is the contribution to 2 peer-reviewed articles that were published in 2015. And the first of these articles is authored by Claudio Di Lorito, and he was working actually on the topic of peer research, and he wanted to see how he wanted to try to develop a model about peer research in dementia in particular. So he had conducted a literature review on the topic of peer research, and then he was trying from there to think about how this model could be actually presented. And he contacted us at that point because he wanted to hear from people with dementia what people thought about this process and about the model he had developed. So we had a consultation with our European working group. We presented the work that Claudio and his colleague had done. We presented the different ideas from the literature that he had been looking at, and from there how he had then developed a new model. And in this discussion we had like some recommendations and feedback to Claudio about what the people felt about what he has written and what they were about to publish. And you can't see there in the slide, there was a section within the article where this work is described, and where we describe the work, the feedback provided by the members of the group and the carers, and how this feedback was incorporated in the model and made change some certain aspect of the model. And obviously the work of the group was acknowledged also in the paper. And there was a second opportunity, and this was in work led by Rosemary Droos in the Netherlands and her team. And she, in that case, was working on the area of social health. And she wanted to actually think about how this concept of social health could be actually applied to dementia. And then again, she was writing this article about social health and how to operationalize in that context, and reach out to us. And we again consider different ways of providing feedback to her. In that case, there was via email, because there was no one meeting of the group at the time. And again, with that opportunity to present something to the group and have their feedback about the concept and the ideas she had. And this feedback again was published as a section within the whole article, so you can then see what happened and what the people thought about all this work. And the feedback was actually included in the article, and the contribution acknowledged also in the article. So that was again 2 interesting opportunities for the group to contribute to research in a different way. And we have presented until now our perspective of how the working group has been working in different research projects in PPI. But let's see what Helen thinks about that. Helen, over to you, Helen, now.
Thank you. Well, our group has been involved, as you can see, in quite amazing work. We're a diverse group. We have very different types of dementia. We come from very different careers, and that is why we are so dynamic. We all have the same vision to change attitudes on dementia. And we also know that the difficulties still around Europe and across the world of not being able to say the word, that if we talk openly about dementia, because it's a fact enshrined in folklore, but if we kill the demon, then first we have to say it's his name. So we can talk about it now, and we can participate, as we do, very much so, in research. We feel valued, and for all of us, it really gives us a great sense of purpose. I think that also, when I say that it's meaningful, it is really meaningful for us, because we think our lived experience matters to PPI research. And also, I think one of the things that we've learned with research is that the language, we have looked at papers that have been, you certainly would need to be a medical professional or a scientist to understand the language. And I think by being working in research with Anna and Dianne and the team, that we've been able to change that and to have a more meaningful language to us. And we have tools. We're not too difficult to deal with. All we want is consistent language, and that it is written easily, but also that we get feedback. Many times in the past, we may have participated. I mean, I'm not saying necessarily the European Working Group, but at times it may have happened that we didn't get feedback. And is it deliverable? You know, and when is it deliverable? So those are things that the European Working Group of people with dementia are interested in. It's good that we have our voices heard also, because we think this is important, and also it is good to help and to mentor researchers, and for ourselves it's good to offer peer support. I think that we must continue to be involved in PPI. It's the only hope that we've got, and so we can break down all the barriers. And to paraphrase Maya Angelou, the human spirit recognizes no barriers. It jumps hurdles, leaps fences, penetrates walls, and arrives at a destination full of hope. And do you know what? We arrive at a destination full of hope when we participate in research, because we know that we are helping somebody. And we all have the same passion and resilience and courage in fighting to kill off the demon of dementia. And we hope that our passion for making people aware of dementia is fundamentally changing the way the dementia is seen and understood. And I think that is really an important message for us as a group of people that try as hard as we can. We give our time voluntarily to work as hard as we can to change the views of dementia and to change and to help researchers. You know, there's nothing more rewarding for any of us than to sit down with somebody from a pharmaceutical company, for example, and to talk to their teams about how we may help them to find a medicine that helps us instead of hinders our everyday life, that we can help them in making more suitable medicines for us. And I also think, as I said in the beginning, that it is very powerful that people can see that we can still be very active citizens, we can still participate in society, and we can still live as well as we possibly can, and that is great for ourselves and for our families. And before I close, can I just say to you what research has done for me? Research in the last year has led me to 2 books, participating in the writing of 2 books. And one of them is called Dementia and Human Rights. The other one is called Global Perspectives and Legal Capacity Reform, Our Voices, Our Stories. And that book is for law libraries across the world. And also yesterday, the National University of Ireland announced that they would give me an honorary doctorate of law for my work in research and advocating for the rights of people with dementia. If I had been told 5.5 years ago that this is where my life would have been because of my love of research, I don't think I would have believed them. Thank you for listening to me. We will continue to work very hard with researchers across the world to make it a better life and to break down barriers, because we are all passionate about making change.
Thank you very much, Helen, for sharing what you consider to be important and meaningful about being involved in PPI, and obviously for your involvement. I'd just like to talk briefly about one of the things that has come out of the PPI activities with the European Working Group of People with Dementia, and that is the position paper developed by Alzheimer Europe and the European Working Group, together with the members of the Interdem Psychosocial Research Network. And this is a position paper on PPI in dementia research. And it was formally adopted by the boards of both Alzheimer Europe and Interdem, and published in Aging and Mental Health in 2017. On this slide here, you can see some of the key aspects which are covered in this paper. So each one of these headings covers the kind of guidelines and Alzheimer Europe's position together with Interdem and the European Working Group of People with Dementia. I'm not going to go into these at the moment now, because we'd like to leave some time for questions from the audience. So I'll now pass you back over to Anna.
So what's next? So when we were preparing the presentation, we didn't want to leave without thinking about the future. and kind of thinking of how this work we think is progressing. And one of the aspects that we have seen over the years is that whilst before, at the beginning, it was like a novelty, PPI was like a novelty, kind of an ideal thing to do, but that only a few did or did in ad hoc basis. Now it's more becoming the norm, and even sometimes a necessity. In some cases because they need to have PPI for funding, but very often because researchers have seen the value, have seen what PPI can bring to the project. So PPI is becoming more a central, a core part in research project as opposed to a more ad hoc activity. And also it's happening earlier and in a more systematic way. And this is why also we as Alzheimer Europe and with the European Working Group, one of the things we are doing currently is that we are involving, for instance, people with dementia much earlier in projects. And for example, we have now examples of involving them in the writing and in feedback on proposals before on research proposals before being submitted for funding. So very, very early on, starting to bring their voices about whether the topic is important, what we are planning to do will be meaningful. And also, due to the kind of more interest and more people being involved, we are developing strategies to coordinate and link the work of our European Working Group of people with dementia with actually other panels of people with dementia and carers who could be involved at national or at more local level. Another aspect that we have observed is that PPI is moving beyond psychosocial research, and now we are having more people interested also from biomedical research wanting to also conduct PPI activities. So this is also something a bit new for us. And in that line, we are kind of thinking about, do we need more training for our members? Do we need to develop further training for the working group? And how can we reach out to more people and more countries? So this is a trend that we are seeing for the future. Thank you to all of you for your attention. We hope that you have enjoyed this webinar, and we look forward now to some of your questions and a bit of discussion.